So is this correct that every year more than 2 million people die due to liver related issues?
I feel that liver disease related deaths must be much more than 2 million.
Every year more than 2 million people die due to liver related diseases. It was mentioned that around 100 million people die due to only fatty liver related issues.
Yeah.
On this topic, we have with us Dr. Ankur Garg, who's a senior hepatologist from Paras Hospital, Gurugram.
So 20% of my entire liver transplant patients today happening on day-to-day basis are because of fatty liver related liver failure.
Can a patient who goes to a doctor and he might be in grade 1 or grade 2, so as per one doctor it could be like no treatment or maybe medications can only help, but maybe another doctor can tell you need a transplant. Is it possible? Welcome, doctor.
Thank you, Dushyant.
So is this correct that every year more than 2 million people die due to liver related issues?
Yeah, see, 2 million is a reported data which is available on Google on a lot of data analysis. But if we see India as a country, this data is always underreported, and I feel that liver disease related deaths must be much more than 2 million.
I was reading Indian data and it was mentioned that around 100 million people die due to only fatty liver related issue.
Yeah. See, fatty liver is a big spectrum, it's a very common word. People feel that, every doctor today we go to is OPD, they just write fatty liver, or maybe it has become a fashion word for doctors. But if we really try to understand that fatty liver is a lifestyle disease and it's a rising silent epidemic. So, 15 years back, we hardly used to do any liver transplants related to fatty liver related liver failures. And today, that number has already crossed 20%. So 20% of my entire liver transplant patients today happening on day-to-day basis are because of fatty liver related liver failure. So if we understand, what 20% means, that's a huge.
So doctor, what exactly is fatty liver?
So see, fatty liver going technologically, okay, it may be very complex, but if we talk from very simple perspective, like we are overweight, we are obese, we have excess fat in the body. So whenever we will have excess fat in the body, this excess fat will go and get deposited in the liver also. So a very simple thing is fatty liver. So only obesity does not have part to play in role. There are a lot of other metabolic things also. People can be prone for diabetes, people can have thyroid issues, endocrine issues, and some amount, maybe, somebody can be a very social or an occasional drinker, but alcohol also plays some role. So it's ultimately at the end, it's a mix of everything. And not that a non-alcoholic patient will not get fatty liver. So fatty liver has been changed now, the term, we call it metabolic associated liver disease, MASLD. So it's ultimately, it is the sum of my metabolism, my insulin, my body weight and my exercise. But in the end result is excess of fat in the body, which gets deposited into the liver. And once excess of fat is in the liver, it hampers the normal liver cells from functioning normally. So
basically, people, it is not just related with alcohol. Anybody can get it.
Yes, anybody can get it.
It can also be genetic?
It can be genetic, yes. See, people have metabolic associated syndromes, like people can be overweight due to genetic reasons. People can have diabetes at very early age. That can be genetic. So these class of patient will be more prone for fatty liver. So yes, in these group of patients, even genetics has a role to play when it comes to fatty liver.
So doctor, what are the general symptoms for a fatty liver patient?
See, fatty liver or per se liver, if we talk about, whether we say it fortunate or unfortunate, but in most of the times in earlier parts of the liver disease, be it fatty liver, be it alcoholic liver disease, be it liver cancer, or be it alcoholic liver disease also, we don't get any symptoms because the functional reserve of liver is very big. So if in true sense, if we talk about that, when a patient with liver disease will have symptoms, that is when minimum 50 to 60% of the liver is damaged. And per se, if we talk specifically about fatty liver, so, as we have already spoken, that these patients will tend to have overweight, they might have diabetes, they might have endocrine population. So rather than focusing on the symptoms, it is more important to focus that, am I at a risk factor for fatty liver disease? Am I overweight? Do I have diabetes? Does I have a family history of diabetes? Is my physical lifestyle not balanced? Or there is too much of, junk food eating or too much of imbalanced diet eating? So I think the more important part is not to focus on the symptoms. More important part is to focus on our lifestyle and to assess that, am I at a risk factor for fatty liver disease before I go for evaluation or before I seek a consultation with a doctor.
So in general, how do a patient gets to know? I mean, as a layman, I'm asking, कि they have a fatty liver. Like there are specific symptoms or specific,
So see, fatty liver at the first time is always a silent diagnosis. You know, a patient visits a doctor, maybe due to some other reason, some other problem, from fever or something. And when doctor orders them a routine blood test and an ultrasound abdomen, so most of the times, more than 90% of the times, if you will see, fatty liver is a bystand diagnosis. It is not
Okay.
a upfront diagnosis. It is always a diagnosis with ultrasound abdomen, but ultrasound was ordered for something else. It might have been ordered for pain, might have been ordered for urine infection, and in that ultrasound it also came as that there is some amount of fat also in the liver. And depending upon the severity, it will be labeled as grade 1, grade 2 or grade 3.
So it can be dangerous if ignored.
See, definitely, if there is a problem and if it is left untreated and uncalled for months and years together, ultimately anything can be dangerous. Specifically, if we talk about fatty liver in concern, yes, grade 1, grade 2 fatty liver may not say anything to anybody and people will live more or less normal life. But if the time progresses and there is no change in the lifestyle, there is no effort to, get back this fatty liver corrected, this fatty liver get converted into non-alcoholic steatohepatitis. So, though it's a technical term, but all that I want to tell is that it will start damaging liver and it will start showing more and more symptoms and more clinical results. And if hepatitis is left untreated, it will ultimately go to fibrosis. And fibrosis, if left untreated, will go to cirrhosis. So, yes, it's a spectrum of disease. And as we already discussed that today 15 to 20% of the patients undergoing liver transplant are due to fatty liver related liver failure. So that is the magnitude of the problem.
Can a patient who goes to a doctor and he might be in grade 1 or grade 2, so as per one doctor it could be like no treatment or maybe medications can only help, but maybe another doctor can tell you need a transplant. Is it possible?
No. So fatty liver, if we talk about, is a reversible disease. Okay. So if we will correct our lifestyle, if we'll decrease, it's basically the excess of metabolism and excess of fat that is getting deposited. So fatty liver is always reversible. Okay. And I don't think so that any doctor at the stage of fatty liver will tell any patient that he or she needs liver transplant.
So fatty liver patient can be a donor for a liver disease for another patient in the family?
See, when it comes to living donor who's donating a part of his or her liver for a loved one, so donor safety is very important. Okay, and so that is a very upfront thing that a fatty donor or a fatty liver patient can never be a donor. See, because this is the liver only that I will be taking out a part of this liver, and this which is I'll be putting it in the patient. So we will have problem both in terms of the patient safety and both in terms of the donor safety also, because fatty liver will not allow us to recover after liver surgery. So fatty liver is a definitive no, and it's 100% no to be a part of liver donor. But yes, when we evaluate liver donors, it is very common that 15 to 20% of them they turn out to be fatty liver. And if it is a very mild degree or a moderate degree, we put them on diet regime and physical regime. And most of the times, donors are able to reduce their weight and their fatty liver is reversed back to normal. And yes, then they can donate a part of their liver.
And one last piece of advice to people who might be into too much of drinking or they're not living a healthy lifestyle. So anybody, who is into too much of drinking, they should be aware that it can lead to, of course, liver damage or fatty liver. Maybe your advice.
See, drinking, I think there is enough, and every common man, whether he is educated or uneducated, whether he's literate or his literacy level may change, we all know that drinking will definitely cause damage. And people have myth that okay, one drink a day is healthy, or one drink a week is healthy. So it's a very big misnomer. Any drink is not healthy. So I always explain this with a very small example, that if a doctor tells you that I'll put a small cut on your skin every day, and this your healing process will always be young by doing this, will you take that cut every day on your skin? So similarly, if I drink, be it one drink or two drink, it will leave some scar on my liver. And as these number of scars will keep increasing, ultimately a point of no return or a irreversibility will set in. So yes, alcoholism, if we talk about, neither at a social level nor at a regular abuse level, it is not advisable at any point in time.
So doctor, who is the ideal candidate for a liver transplant?
So you see, if we talk about indications of liver transplant, it can be sectioned into many things. So acute liver failure becomes a separate category, chronic liver disease becomes a separate category, and liver cancer becomes the third category. But from interest point, let's focus our conversation primarily to chronic liver disease or cirrhosis, what we call as. So any patient who gets decompensated cirrhosis. So then the question comes that, what is cirrhosis? So cirrhosis is a term, of course, it's a medical term. But whenever we say that the liver has been damaged to the end stage, by end stage, we say that it is not reversible now. The liver damage has happened to this extent that the liver cannot recover. So whenever any patient gets end-stage liver disease, or sometimes we call it decompensated cirrhosis, we say that this patient is a candidate for liver transplant. So then comes the question that, does every cirrhotic patient needs a liver transplant? So see, cirrhosis is a time-based process. Nobody gets cirrhosis in one day.
Immediately, yes.
It's a chronic disease. The cause can be alcohol, the cause can be fatty liver, the cause can be hepatitis viruses, or it can be drug-induced liver injuries. Cirrhosis develops slowly over a period of time. It's a chronic disease. Nobody gets cirrhosis in 2 months or 1 month. Any patient who becomes a cirrhotic patient, it's not that he needs liver transplant at that point in time, but eventually cirrhosis is a progressive disease. So, it is very much possible that a patient has a diagnosis with cirrhosis and he's living an absolutely normal life. His work life, his family life, barely any symptoms, or maybe some fatigue or loss of appetite. But eventually cirrhosis will progress and he will have some form of complication, and most of the times that complication is either jaundice, or it is developing of too much of water in the stomach, or it is a blood vomiting, variceal bleeding, or some patients, they lose their sensorium, they go into altered senses. We call it as hepatic encephalopathy. So these are the normally either these of the four things will be a decompensation symptom. So when any liver failure patient or when any cirrhotic patient has any of these complications at the first time, that is the best and the highest time that patient should be counseled for liver transplant. He should have understanding for the liver transplant. Going further from here, the number of complications will only increase. The number of hospital admissions will only increase. So the sooner we intervene, better are the results, quicker is the recovery. And liver transplant, we say, is just not a life-saving surgery. It's a life-modifying surgery. The health, the nutrition, the vigor, everything comes back after liver transplant.
So how do you manage a patient with liver cirrhosis versus a liver cancer patient? Like the treatment protocols are completely different, maybe dependent upon the indications or the scans you see.
So see, liver cancer, very important point to understand in liver cancer is that most common liver cancer is a metastatic cancer. That means cancer is arising from somewhere else. From stomach, from pancreas, from uterus and ovaries, and it has come to the liver. So that is the most common liver cancer. So here, when we talk about cirrhosis and liver cancer, we are not talking about a cancer which has come from other body part and has come to the liver. Here we are talking about a cancer which primarily has arising from the liver, what we call as hepatocellular cancer. And 90% of the hepatocellular cancers will always happen in a patient who has underlying cirrhosis. So a primary liver cancer will never happen, not never, it will less than 10% of the times it will happen in a normal.
So majorly you are saying that cancer maybe is in the breast and maybe or some other organ.
Yeah.
It has now metastasized to the liver now.
So that's altogether a separate
category. Altogether we'll be using the medical management for them.
And when we talk about that liver cancer and cirrhosis and transplant, so here we are always talking about a cancer which is arising primarily from the liver, not from anywhere else. Okay. And as I told that 90% of these patients will also have underlying liver cirrhosis. So when we treat patients with liver cancer, it is treating both the parts. It is treating their cirrhosis also and it is treating their liver cancer also. Not that every liver cancer patient or every is a candidate for liver transplant, but yes, there are a lot of criteria, we can't go into that depth on this discussion. But yes, if patient fulfills those criteria, then yes, liver cancer patients can undergo a liver transplant. It is both a curative treatment, not only for their cancer, but for their underlying liver disease as well.
So, doctor, how easy is to do a transplant? Maybe we are saying so easily and discussing so many things, but as a doctor, when you go into the OT, that is the time. Everybody is from the family, they are just waiting outside how well the surgery would be.
Yeah, so see, if we talk about technicality or if we talk about how much training does it require to do a liver transplant, it is definitely a very complex surgery. In fact, it is one of the most complex surgeries that can happen on a human body. But over a period of years, now with the number of professionals available, the number of centers that are there, which are totally equipped, liver transplant cannot happen in any hospital. It can happen only in certain setups which have got those kind of infrastructure, which has got those kind of licensing and government approvals also. But today, in present day world, in 2026, if we talk about, yes, there are enough centers and there are enough trained professionals and teams doing liver transplants very successfully. And that's why.
So how many people are there in the OT when you do a surgery? How big is the team?
So if we talk about, so in liver transplant, there are two operation theaters. One is for the donor and one is for the recipient. So there are two OTs which are going parallel. And if I talk about surgeons, anesthetists, technicians, staff and everything, so at any given time in a liver transplant, at least 20 to 25 people are involved inside the operation theater on both the sides.
And the specialists, like doctor who are performing the transplant, like you must be having subordinates.
So minimum there will be 2 surgeons on the recipient side and 2 surgeons on the donor side. This is minimum. They can be 3 as well, but 2 surgeons is minimum on each side. So at any given point in time, if a liver transplant is happening in a hospital, 4 surgeons will be busy operating on the patient.
So what is your biggest challenge in convincing a patient for the transplant? You might be seeing so many patients on a daily basis, and then you might be finding one patient or weekly one patient who needs a transplant. But they must be having apprehensions. They must be doing or going to different doctors, and everybody is giving them the same option.
So, the biggest challenge when it comes to dealing patients with chronic liver failure who need liver transplant, first is, of course, their acceptance. When we tell them that now liver transplant is the only solution. So some people, in fact, I'll say 50% patients upfront, they will not have acceptance to it. They see, as a common man, even I will feel that, if I can be treated with medicines, it's okay. Even if I have to come to hospital every day, I'm okay with it. But, I don't want to undergo a transplant. Second, then there is a very big myth that, whether transplant will be successful or not. Howsoever we may, today liver transplant carries a success rate of more than 95%. But for a common man, they don't believe it. Even they question me, is it true that it is more than 95% successful, or is it just that you're luring me? So it's a very common question comes to me. So acceptance is the first challenge that comes to it. Second challenge is about, yes, they have so many apprehensions that how my life will be after liver transplant. Will I be able to walk after liver transplant? And on top of it, the cherry on the cake is when we tell them that, donor also has to be from the family. Then to as if, the dooms gets broken.
They might be asking you, can you get a donor for us?
So that's a very common question. But there we have to understand the law. That's the Human Organ Act law of India, that only a family member can donate a part of his or her organ to a family member. So, whosoever.
It is a process, basically.
It's a process.
To identify
that's the legality
of
the transplant.
And how easy is to convince a donor? Of course, donor, they themselves have so many apprehensions. Comparing a kidney transplant donor versus a liver transplant donor, I think liver transplant donor are better placed. We can at least regrow their organ.
Yes. So, that is where the understanding varies. A layman can say that, okay, I have 2 kidneys, okay, I can donate one, I will still have 1 kidney. But a friend question comes, when we tell them that you will have to donate your liver also, that I have 1 liver only. How can I donate it? So there, we have to make them understand that, liver is a very dynamic organ and it's a regenerative organ. In fact, it is the only organ in the adult body which can grow, which can repair, which can regenerate. So then we explain that we take, only some part of your liver and your remaining liver grows back to normal within 4 to 6 weeks. Yes, so that's the most common question. Before from the donor, it comes from the recipient only that how can somebody donate liver from my family?
How is the recovery goes, both of them? Like or maybe donor, it is a smaller recovery process?
Yes, definitely. So see, donor gets discharged from the hospital within 6 to 7 days. And within 15 days, for some, it can be 20 days at max, they are as fit as they are today before surgery. Be it their physical life, social life, mental or psychological life, they are fit to resume it after 15 to 20 days. There are no restrictions in their future life, no medications, no follow-up. And they will lead an absolutely normal quality of life. Coming to patients, yes, patient recovery depends at what stage they choose to come and get a liver transplant done. So it can vary. But for most of the times, if we do a timely liver transplant, patients also get discharged from the hospital within 15 to 20 days. And another 2 to 3 weeks or 4 weeks, they take their nutritional recovery to happen. So we normally say that after 8 to 10 weeks of liver transplant, you will be fit enough to drive, to go to your office, to take a field job. In fact, so many of my patients are from, water security forces, from Delhi police, Haryana police. They're back on their field jobs after liver transplant. So I'm just telling that so that, people can understand that what will be the fitness level after liver transplant. It's a near normal fitness level after liver transplant.
So comparing a kidney transplant patient versus a liver transplant, you find liver transplant results are better, or is it like dependent upon many things? What I have seen is patients who have undergone a kidney transplant, their survival may not be as, I don't know. Is there any difference in the survival
so
rate?
There we have to understand that, let's talk about, in small comparison. Now we are dealing a patient with kidney failure. So this patient is likely to have a heart disease. This patient is likely to have diabetes. This patient is likely to have high blood pressure also. These are the reasons that his kidney got damaged. Okay, he must have been on dialysis also. And unlike, liver transplant where there is no dialysis. So these patients are generally suffering for a very longer period of time.
Multiple diseases
attached. And then they undergo a kidney transplant. So yes, kidney transplant, what will kidney transplant do to them? It will make them dialysis free. But will it give their nutrition back to them? Will it give their health back to them? That is a time-based process. On the contrary, when we talk about liver is a factory of our body. It's a powerhouse of our body. So once the powerhouse is damaged, and after liver transplant, I give a new powerhouse to the patient. So imagine the spectrum of recovery that happens. The muscle mass, the nutrition, the skin color, everything changes. So from that perspective, if we talk about, that's why I say that, liver transplant is a life-modifying procedure. It's a life-transforming procedure. So I'm not saying that kidney transplant is not good.
So basically the disease doesn't go away. In a CKD patient, a chronic kidney disease, the disease is still there. We're just stopping basically a dialysis process. They're just, for going further, they can at least have a new kidney, but they are still prone to maybe some kind of
that this new kidney can also get affected.
Immunity is low and all those things. So let's say the international patients who come here, how do they prepare themselves before coming over to India? Because you see there are so many hospitals, so many doctors now, the infrastructures are great, the advancements have happened. So they also get confused.
Yes.
Finding the right fit, finding the right pricing, and of course the outcomes matter the most. So how do they choose a right hospital and a doctor?
So see, for international patients, it's very important, and I'm sure that most of the international patients who are coming for liver transplant to India, at some point in time, either telephonically or in physical presence, because a lot of doctors travel outside India also for conducting outreach camps. They have been in contact with some Indian doctor who has already briefed them and counseled them that, you need this is the process, these are the legalities once you come to India, you will be needing translator services. And, so these all assurances and promises have already been made to them either by healthcare facilitators or by hospital marketing teams or by the doctors visiting to these countries. So I think when these patients, they land to India, they are much aware of it, that at least in their mindset, not in reality that, okay, these are all the things that we need to be prepared. Coming to India, yes, they have many choices, especially coming to a city like, Delhi NCR, which has one of the highest end hospitals, healthcare infrastructure, and one of the country's best leading doctors also available in the city. So yes, they have choices. And if you ask me, liver transplant as a process or as a hospital, I feel that any hospital who is into liver transplant, they are already, top A level hospitals in Delhi NCR, because they have already that kind of infrastructure. They have already obtained those licenses and clearances from the government for conducting a liver transplant. And if we talk about liver transplant team, if somebody is choosing to do a liver transplant, be it me or be it any other surgeon, he has already undergone that rigmarole of training and years of, education and all that. It's not that, appendix or a hernia surgery that even sometimes a technician can do it. So I feel
I think majorly they should look upon the infrastructure, the experience of the doctor, the number of transplants the doctor has performed, and of course the outcome of the department as a whole. That is important.
Definitely.
I think the biggest challenge, what we have seen up till now, is of course finding the donor. And I've been thinking a lot that some countries like Egypt is one of them who give a donor, you can bring your donor up till 4th degree as well. They have to be just citizen. Why can't India have such rule? Do you think that this rule can be helpful even for an international patient?
Rule, if you talk about Human Organ Act Law of India, it came way back in 1994. So there is a reason and a purpose that, why the law is strict. When we are talking about, if my family needs a liver transplant or my loved one needs a liver transplant, I will want the rule to be as flexible as possible. But, on the contrary, if I am an influencer, and the rule is lax, then, I will start trading in organs. I will start buying organs. And every now and then, howsoever the rule may be strict, more in kidney transplant to very less extent in liver transplant, we do read articles that an organ racket has been busted, illegal transplants were happening. So, if we will abolish this law, what will start happening is, the rich will always buy the organs from the poor, or more powerful will always buy the organs from the less privileged.
So it happens more in kidney cases, not more in liver.
Yeah, because doing kidney transplant is a very simple technical process as compared to doing a liver transplant. So kidney transplant can happen in smaller setups. Kidney donors can be discharged within 1 day. We talk about liver transplant, it can happen only in very, top modern infrastructures. And even liver donors, it's a very complex surgery. So yes,
recently we heard about many hospitals got raided with, especially with the kidney cases. That's what we have, and primarily it happened more with the international patients.
Yes.
Yeah, because I've seen there are different rules in different states.
Yes.
So some hospital they try to get leverage in the other state. They get the patient in Delhi, they take somewhere else, and of course.
At the end of the day, we all are human beings. When it comes to own self, I will try to do everything, to get benefit.
No, still I feel that, of course, the rules are rules. We have to, follow them. Yes. But at the end of the day, if we have a bit of flexibility and it saves life, what is the harm in that? They're getting a patient from their own country and we don't know. I mean, of course, they could be from the family. Sometime even they're getting a patient and all the documents are being made properly. We still don't know whether they're from the family or not.
Yeah.
How can we identify?
Yeah, sometimes, it becomes challenging to identify that. That is why, the legal process is always, it's not a part of a doctor or a surgeon. So legal committee is always by the medical superintendent, by the CMO of the hospital and DC also of the district.
Yeah.
Yes, it is challenging at times. And I think that is the only reason, there are so strict norms. As long as everything goes fine with the donor, it's not a problem. But, if something happens
something
to the
goes
donor,
wrong.
And some percentage of the cases, something will happen to the donor. And you never know that, how he was coerced or how he was pressurized to donate a part of organ or what part of life, you really...
Then everything
what
comes
benefit
out.
you have taken out of it. So I feel law is important and it should be very much
important. Yes, we all have to follow this.
Yes.
I think if somebody who doesn't have a donor and matching donor primarily, so what kind of options we have? What kind of transplant we can do?
Either we can offer them a ABO incompatible transplant or we can register for diseased donor liver transplant. Okay. But registering for diseased donor liver transplant can happen only for Indian citizens.
Yes.
It cannot happen for foreign nationals.
So what exactly is ABO? ABO transplantation.
So ABO incompatible transplant. So normally in liver transplant, it has to be a blood group compatible. So for a very broad person, a same blood group can always donate to a same blood group. O blood group donor can donate his or her liver to all the blood groups.
Yes.
And a AB blood group patient can take liver from all the other blood groups. So this is a broad rule. Supposedly there is a patient with the A blood group and he does not has donor in the family either with A or O blood group. So we have only two other blood group options, either a B or a AB. So if we are putting a B blood group liver to a A blood group patient, that is called ABO incompatible transplant or vice versa. Putting a A liver into a B blood group patient.
So that is a more complex procedure comparing a normal matching donor transplant.
Yeah, so in ABO incompatible transplant, of course, we first have to assess the feasibility. That is ABO incompatible transplant feasible or not. Not that it is feasible in everybody, but yes, in more than 80% of the patients it is feasible. And technicality of the surgery remains the same. You take a part of liver from the donor, you remove the patient's liver and you put this part into the patient. So the surgery component remains same. But yes, the medical management and rejection management is different. So there is a slightly different protocol. These patients will require 15 to 20 days of prior treatment before undergoing a ABO incompatible transplant. But with the advent and the progress of modern immunosuppression, today ABO incompatible transplants also carry a success rate of more than 90%.
So 95 you're saying is for the matching.
For the matching.
And for even ABOV goes above 90.
Above 90%, yes.
And how many of these cases you get?
See, I think on an average, every transplant center, their 10% of activity today is around ABO incompatible transplants.
So the patient, they also understand that finding a matching donor is better for them. They still find somebody in the family.
No, so our first choice or anybody's first choice is always a compatible transplant. Only in these situations where, unfortunately, there is no blood group compatible donor. That comes the question of ABO incompatible.
So I think post-recovery plays a very critical role as well. Somebody who undergoes a transplant, like for an international patient, they might be here for 2 months or 3 months. Once they go back, and especially for those patients who are living in places which are high infection zones, what kind of protocol you advise to them? How do you manage them once they go back so that, ultimately the outcome for an international patient is critical? So how do you see?
So see, upfront, any patient who's coming from abroad, we always tell them that after liver transplant, after discharge, you will have to stay close to the hospital for next 2 to 3 weeks. So that is very crucial in managing and streamlining their immunosuppression. So by the end of 3 to 4 weeks after discharge from liver transplant, most of the patients are fit enough that they can travel with public transport. Of course, air flight is also public transport at the end of the day. And going back, they will be able to take care of themselves. That means they can eat by themselves, they can bathe, they can do their normal activities by themselves. And within next 2 to 3 weeks, they'll be fit enough to resume their work life also back to normal. So that's the point, So minimum 2 to 3 weeks is the waiting time after discharge. We advise and we tell. And we make sure that it is forced upon. If somebody says that, no, I will not agree to it, I will rather choose not to do liver transplant also in such a patient.
Like we have seen in kidney patients, they have to really, really take care.
Yes.
Like with infections, when if anybody gets certain infections, so their immunity is already down. So sometimes there is a relapse as well.
Yes.
They may require another transplant. So in liver as well, do they have to take care the same way with the infections?
Yeah. So see, immunosuppression is required in every transplant, be it kidney or be it liver. But the beauty of liver is that liver is a very immune tolerant organ. So the amount of immunosuppression that is required in liver transplant is way far less as compared to a kidney transplant. And when the immunosuppression is less, the side effects are less. When the immunosuppression is less, the chances of infection are less. So if we talk about quality of life in a patient who has undergone a kidney transplant, which is a very smaller procedure, vis-a-vis a patient who has undergone a liver transplant, which is a much more complex and a lengthier procedure, quality of life of a liver transplant patient is far, far superior as compared to a kidney transplant patient. Quality of life after transplant.
And have you seen any case wherein you need to repeat a transplant for such patient because of XYZ condition? Is there a possibility?
There definitely is a possibility. For this, there can be the graft related issues, there can be technical surgical related issues also, and there can be like going back to alcohol, recidivism risks. And very rare cases, when we do transplant for autoimmune hepatitis, in less than 5% of the patients, that disease can come back.
Rejection, chances of?
Rejection, very rare. If you'll ask me that, what percentage of liver transplant patients will likely require a retransplant due to rejection? Maybe it's 1 in 1 lakh.
Okay.
Or, 10 per million.
And are these majorly the ABO transplant being done, they are rejected? It could be, or maybe in the matching as well?
No, in the matching as well. And, definitely some loss of compliance on the patient end has happened. Somewhere they have become irregular with their medicines. That is a very major reason for patients undergoing chronic rejection and graft loss. But yes, if we sum up the total, the number remains very low. It's like, 10 in million liver transplant patients will require retransplant due to one or the other reasons.
So, Doctor, where does India stand when compared the Western world? Are we doing, or we follow them? Their latest advancements, how fast we get the advancements in India?
What if I tell you that India is far way ahead as compared to Western world when it comes to liver transplant?
Okay.
So India today on world map, stands number 2 as a country for living donor liver transplant. Whereas the Western world means majority of the Europe and US, if you're talking about, Their primary liver transplant is disease donor liver transplant, where we are taking organ from a brain dead donor.
Okay.
So no living donor.
No living donor is being done.
So the complexity of the surgery is way less. The ethical burden for the transplant is way less. It's altogether a different discussion. If we talk about the advancements, the expertise, the hospitals and the doctors, liver transplant trained people I'm talking about, of course, India is way ahead than the Western world.
So I think the another important fact is the waiting time. If anybody who thinks about getting their treatment or a transplant done in India, how fast they can get it?
See, waiting times comes into picture only if you're talking about disease donor liver transplant. And when we are talking about disease donor liver transplant, only an Indian citizen can get it. A foreign national cannot get it. So primarily, India is a country where we do living donor liver transplant. So by living donor liver transplant means my loved one or my relative is only donating a part. So there are no waiting times. It's a elective planned surgery. I am a patient. I need a liver transplant. My family member is donating a part of liver.
Yeah.
We medically evaluate. We are fit. We go for the legal clearances, and transplant can happen as early as within 3 to 4 days of patient.
So if everything is get clear, so once a patient lands here with the documentation, I think once we sort out these legal things, within a week's time, they can get it done.
Yes, most of
so that is the beauty, I think.
Yeah.
If we compare the Western countries, go to UK, go to US, the waiting time, even for getting small tests done, is huge.
Yes.
Getting an MRI takes 3 months, 4 months down the line.
And even, for foreign nationals, it's not that easy to get listed themselves in the Western world.
Yeah.
There also the preference first goes to the national.
Correct.
So whenever it is about diseased organ donation program, it's the country resource. If I am an Indian citizen and my organs are getting donated, it's the Indian organ, right? So the first preference will definitely be given to an Indian citizen. And it should be how that is.
So any last piece of advice to patients who are seeking a transplant, who are their loved ones suffering with a liver disease or looking for a good liver transplant specialist?
See, my advice is only one thing, that if somebody has already reached a stage, due to whatever the reason may be, we are not going into the depth of it, and they have been diagnosed with, end-stage liver disease, with decompensated cirrhosis, having complications, first to have an acceptance that, okay, this has already been done and the final cure treatment is only liver transplant. And the day that acceptance comes, my advice is only that the more delay you will do in coming and getting your liver transplant, more is the price you will pay, not only in terms of, real money, in terms of your outcomes, in terms of your success, in terms of your suffering. So my advice is that don't have too much of, mistrust or dilemmas. You should be well informed. There are enough articles, there are enough talks. You should be well informed. And as far as India is concerned, and patients coming from abroad, international patients coming from abroad, Indian healthcare industry takes very good care of them. Right from, providing them translation services, picking up them from airport, arranging their guest houses. Rarely I have seen that, international patient coming to India and, getting lost. And for example, in your work, there are so many patients you facilitate. And it's not that, we are saying it for the sake of it. You read the reviews, you read the testimonials, they go happy back. Correct. And that is our end point. We want you happy back in your family life, in your country back. So that's what we are here.
So doctor, why a children has to undergo a liver transplant? And the way transplant done for an adult, are there any differences for a children liver transplants?
So if you talk about pediatric population, if you talk about liver disease, the spectrum of liver disease in pediatric population is entirely different. If we talk about pediatric liver transplant, the most common indication is biliary atresia. It is a genetic condition. Children are born with it. And by the time most of these children are of the age of 6 to 10 months, they have already gone into a full-blown liver failure. And as early as 5 months, 6 months, they might need a liver transplant. So yes, transplant will remain transplant only, a part of liver going to a child. But yes, if we see such a small child, 6 months child, 10 months child, 7 kgs, 10 kgs in weight, they need a very small portion of liver. Unlike a adult liver transplant, where we take almost 50 to 60% of the liver. So in pediatric patients, we take a very small part, just 25% or 20% of the part of liver. Most of the times the donors are either of the parents, mother or father. So donor surgery is much more safe for the donor in these cases. But pediatric liver transplant is much more challenging because the size of blood vessels, the size of ducts that we have to join it is really way too small. And children are very delicate. They heal very fast, but they become sick also very fast. So yes, pediatric liver transplant is definitely a more challenging transplant as compared to adult transplant. But at our center, we are as equipped as to do pediatric liver transplant as adult liver transplant.
So are there any cases wherein the transplant has to be done when a child is born and you feel it may be required immediately? Are there any conditions?
Yes, there are conditions. So if you talk about a liver transplant performed in a very early age, within the first month of life, yes, it's a Guinness Book of World Record. Okay. Not that I have done it, but yes, doing a liver transplant on children less than 7-8 kgs is definitely much more challenging. So most of the times we say that a child has to be 8 to 10 months and has to be minimum 8 to 10 kgs before because it is not about doing the surgery. It is about recovering a child after the surgery. So managing patients with 3-4 kgs of weight, those small babies, after liver transplant really becomes very challenging. So not many people choose to do it, and not very successful results people get in over. Yes, but if it is about life saving, as early as 1 month or 2 months also a child may need liver transplant.
Doctor, do we have now specific pediatric liver transplant specialist, or like you perform both pediatric and adult cases?
If we talk about India, unfortunately there are no specified pediatric liver transplant centers. So most of the centers, I'll say more than 90% of them, who are doing liver transplants normally for adults, these are the only centers who are doing transplants for for pediatric population also. Of course, centers who do pediatric liver transplant, they have a separate pediatric ICU. They have those pediatric nurses, they have pediatric hepatologists. So even in our team, if we talk about when we deal with children, so there is a separate set of nurses who will take care of these children. There are a separate set of ICU doctors who will take care of children, because their needs are different. But surgeons, yes.
So nursing staff plays a critical role in the recovery process.
Nursing staff is, I think, the backbone of any healthcare industry, and they are the ones who are day in and out with the patients.
So doctor, I think second opinion also plays a very important role for anybody, which is also fair enough for a patient seeking their best doctor or a hospital. So in your opinion, how many opinions a patient can take?
See, I feel, people take second opinion. Yes, it is a justifiable human behavior. And when we talk about especially procedures like, transplants, cancer surgeries, kidney transplants, people will tend to take second opinion, and they should. Sometimes it broadens their perspective. Sometimes it brings them the acceptance that, okay, now I have asked from 2-3 different hospitals and doctors. Everywhere I have got the same answer. So sometimes, second opinion helps in that way. It makes the patient prepared and convinced that, okay, what doctor has advised me is right. I should not be doubting that. As a doctor practicing for so many years, and as a common man also living this life, I feel too many of opinions will definitely, corrupt anybody's mind. So there is no appropriate number that how many second opinions should be enough. I always tell my patients, that you seek as many till you feel satisfied, and with whomsoever hospital and with whomsoever doctor, you felt that, okay, I was satisfied talking to doctor here, my queries got answered. The dealing was good, the behavior was good, and I'm happy.
I think how much time the doctor is giving to how much they're hearing the patient.
So see, nobody is best. In one perspective, and in other perspective, everybody is best. If there are 10 liver transplant centers, everybody is best. So it is a perspective. For one, it may be best. For one, it may not be best. So wherever I feel as a human level, we feel happy, satisfied, and content that my queries, my concerns have been answered, I think we should.
I think in our practice that we have been seeing patients, I mean, of course, we counsel them at certain level. So generally a patient consider a doctor who hears them the most. Listening the patient, I think, is the must thing. Any doctor who is counseling them, generally how much time we are giving to them, that is important. But still there are patients who try to move to maybe 50 centers or 50 doctors. You get confused.
Empathy and compassion, it's very important in medical field. So that has to be there with the patient, of course.
So which is your most challenging case up till now?
So, challenging cases, if I look back at my career and I reflect, yes, they will keep changing as per my stage of career, as per my training years and experience years. So what was challenging to me 10 years back is not challenging to me anymore. So for So if we talk about technical challenge, and one, there can be an emotional challenge that, there is a patient whom you have been connected for years, you've been treating them. And now finally the day is coming that, this patient is undergoing liver transplant. So sometimes that, it can be an emotional challenge. Sometimes it can be a technical challenge. But yes, challenging in term, what people say that, okay, this was the most difficult case. Yes, then there are people who come with, their portal vein is already blocked, their hepatic veins are blocked, and we have to put artificial veins, we have to put artificial grafts, taking all those out. So yes, these are the challenging cases which are technically much more demanding and much more time consuming as compared to normal liver transplants.
Thank you so much, doctor, for joining us today and passing on such valuable information to all our viewers. Thank you so much.
And thanks to you also for bringing all these topics, Yes, any doctor can speak at length, but to bring this effort, to bring this topic, and making reach to the people who really want to listen to them, really I appreciate it. Thank you so much.
Thank you so much.